One wrong twist and you can lose a testicle in a couple of hours. So if any guys are watching, or if you have any friends who are guys, please share this video. Something called as torsion testis is there. What is this? In some people, the testis that is normally present in the scrotum undergoes a abnormal twisting that leads to cutoff of the blood supply to the testis. This is a serious and an immediate medical emergency. So, in case you guys have a testicular pain that develops out of nowhere, it's a wise decision. Rush to a surgeon first, undergo a scan, and then get treated immediately. Don't wait seeing that my pain may come down later. No. So, in case there is a sudden pain in your testicles, it could be like when you're sleeping, there's pain, or if you had a trauma also. In case you have a testicular pain that has suddenly appeared out of no particular reason, you had sudden intense pain in your testis, and then you find particular testis has been swollen, it is wise to seek a surgeon's opinion immediately. So what is torsion testis? Torsion testis is a condition where the testis along its axis undergoes rotation by itself. So why does this happen? There is no particular reason. It is a idiopathic, meaning there is no particular cause why this happens. So it can happen to anyone. So in case you have sudden excruciating pain in your testis, wisest thing, go to the surgeon, get an ultrasound done, and in case a surgeon tells we need to operate, don't wait. Don't run around trying to pick, I want to get second consultation, I want to go to my hometown and get operated, I have my parents that need to come. No, this is a medical emergency. If you do not operate ideally within the first 6 hours, you will lose the testicles. So you lose 50% sperm capacity in that particular body. So it is a complete medical emergency. There is no option or scope of delay in such conditions. What are the signs of torsion testis? Sudden excruciating pain in your testis, testis or the scrotum on that side appears swollen, there is pain on touch of that particular testicle as well, and sometimes it may be associated with vomiting and nausea because your spermatic cord is getting evolved. So in this case, what is the option of medical treatment, or what are the way we investigate? You walk into a hospital with a torsion testis or a suspected torsion testis. You will be rushed to an ultrasound scan where we assess the blood flow to the testis, whether the blood to the testis is going in correctly. Reasonably, because of the latest advances in technology, the ultrasound is a good enough investigation to assess the blood flow. If there is no flow, you have to get operated as soon as possible. It could be next couple of minutes or next couple of hours. So based on your medical condition, again, we'll do some basic investigations, rush you to the theater, and what is the surgery performed is we go for an untwisting. We untwist the testis, we give some good amount of oxygen, we cover it with warm gauzes and mops to see if the blood flow is returning. Based on the change in color of the testis, we are able to assess the blood flow. And then what do? We fix it in place to the lower part of the scrotum via a stitch. So this is a surgery, something called as orchidopexy, where we fix the testis to the lower part of the scrotal muscles, so it doesn't get elevated or doesn't get abnormally twisted. Now, as a rule, the opposite testis also is fixed, because once there is a chance that it has happened on one side, there is a high likelihood that can happen on the other side at a later point of time. So what we do, we take a bite on the other testis as well and we fix it. Now let us say you have delayed your visit to the hospital. What do? In such cases, we have to remove the testis on that particular side. We remove the complete testis and we have to basically tie it, suture it, and we remove the testis. Now, this is common in youngsters actually, that age between, let us say, that 14 to 30. It's a very common phenomena in youngsters, the torsion of testis happening. Such cases, let us say torsion has happened, you have delayed your visit to the hospital, or the torsion is too bad that it has caused necrosis of the testis, we remove the testis. Now, what has to be done at a later stage? Because of the technological advances, there are sperm banks present. So after surgery is done, after your recovery, let's say 2-3 months, we always advise all the patients to have their sperm stored in a sperm bank, because let us say in future when you're getting married, you have infertility issues, the opposite side testis undergoes atrophy or some decrease in sperm count is there, the frozen sperms will always help you in your fertility issues at a later stage. So storing your sperms in a sperm bank will be a great idea after you undergo a complete excision of a particular testis. Now, this being a medical emergency, no use of trying to seek a second opinion. Please try and reach out to a hospital where a surgeon is available immediately. Do not waste time. Do not waste time in thinking that I will call my friend, I will call my wife, I will call my relative, my mother. No, no wasting time. Surgeon advises you, get going and get the surgery done. Insurance approval, all those things can wait. Testis is a very important organ, as you guys know. So preserving it would be the ideal and fastest way to get a better recovery. Last option would be removal of the testis. And now for some people who have undergone removal of testis, because of confidence issues, sometimes there's no one testicle available. There is option of something called as a testicular implant that is present, just to make you feel the presence of a testis. This also is being done rampantly nowadays in case of a missing testicle. So this is another option you can explore. Hope this was useful, and in case you have some emergency, please, please, please don't back down and don't wait. Undergo the procedure as early as possible. Thank you.